Well, thanks for joining me. My name is Abhinav Gautam, right? I'm the co-founder, chief medical officer of a company called Carevoyance, and we are essentially a software company that's producing the semantic web for healthcare. So before we get started into the live app, we'll just a couple quick slides for context. So, right, some things that are going on in healthcare that I think we're all aware of. It's extremely cumbersome to connect the dots of this highly fragmented landscape. Right, and as Mark Andreessen said, as software is eating the world, right, we're having more and more data, yet that creates another problem of what to do with that data, right? So it's this exponential data burden that we're seeing. And today, while our application is used in a variety of different ways, today we thought while we're in DC, we do something different and show you guys how we're tackling the problem of healthcare fraud, particularly Medicare fraud. Right, and current fraud prevention is pretty simplistic with the heuristics and manual methods that are currently being used, right? So what does our solution do, right? We basically break down the technical barriers that prevent the discovery of actionable insight, right? So we facilitate this process of asking the question, finding the answer, measuring the solution, and then repeating that process. So real quick, right? While we can, the numbers are variable. Long story short, it's a huge problem, right? And it costs this country a lot of money. So what does our platform do? We basically connect, all of these disparate data sources into our warehouse, and then facilitate analysis, visualizations. Essentially different modalities that help people get to the answers that they're looking for, right? So if you think about things from a layer perspective, right, our first layer is to acquire and link the data, right? The second layer is providing the ability to search that data, right? The third layer is bringing those search results to life via visualizations, right? And then the top two, much more advanced, are providing automated insight into that data, and then the last is via machine learning, providing recommendations, right? So a couple things real quick, right? These are some improper payment schemes that occur, right? So upcoding, pill mills, fraudulent networks, exclusions, etc. Right? And this is available online, so we want to spend most of the time showing you the application live. And we get data sources from a bunch of different places, right? Federal, state, the web, etc. So without further ado, here is Carevoyance. And what I think would be interesting is we'll just do a search for ophthalmologists and see what happens, right? Because it's a field that's interesting. A lot of people have diabetes, particularly where I live in Florida. So very quickly you can see you can input the text into the specialty specialty input, right? And everything is in an elastic environment that autofills. So up here you can see the tags that are associated with the query are finding us ophthalmologists, individuals, not organizations, and then sorting that revenue high to low, right? So we have it in both a list view and a geospatial view, right? So as we look into Florida, there's 1,400 providers, and we'll start to dig a little deeper into who are these providers, right? So sorting by revenue, you'll see Mr. Solomon Melgen. He is an ophthalmologist that billed $86 million to Medicare in 1 year. Something else I'd like to show is if you see, this is the utilization data that Mr. Niall Brennan just released yesterday, and we've already ingested that data set into our application, and this is live, right? So 2013-14, $86 million, right? 84,000 referrals and a bunch of procedures. So if we could just hold on a second. If you can look at the screen, right, this is a logical flow of what we call our physician dossier, right? So the first screen, the overview, kind of gives you a bird's eye view into who that provider is. And then as we move left to right, we kind of get more and more detail. So where do they practice? Now we can dig into their financials a little deeper, right? So if you can see, you can really pivot three different ways: the number of procedures, the number of beneficiaries, and the estimated revenue. And this visualization allows you to really quickly surface and understand productivity and basically ratios of productivity, right? So Mr. Melgen is all the way on the left. The average for his specialty in West Palm Beach is here. The average for Florida is here. The national average, and then for his specialty. And as you can see, we're reaching a point where we can't display the other values any smaller, otherwise they wouldn't exist. That's how big of a superstar this guy is or was, right? And you can see, right, $2 million worth of eye exams when the average guy is billing $10,000. Right, $40 million for an off-label FDA Avastin injection to the eye, right, for anti-neogenesis. The average guy is doing, well, still a respectable $500,000. So if we go into the network now, as you know, we're providing the ability to logically dig, you know, the way your brain works logically. So this guy is a high, you know, he's a very, very productive individual. So where does he getting his patients from? Because he's a specialist, right? Specialists in this country receive patients from primary care physicians. So you can see here, and we've got multiple years of data, right? This is for 2013, inbound, order by total number of referrals, group by specialty, right? So this is a distribution of his inbound referrals, right? So let's look at internal medicine, because that's a good place to start. So this is where he's getting all of his patients from internal medicine physicians, right? And Mr. Gerard Flores is sending him 14%. So logically, if someone's billing $80 million worth of procedures, we want to know where, you know, his number one source of patients are, right? Mr. Flores is a nephrologist, an internal medicine physician, who's making $3.8 million off of Medicare, which is a large number. And you can see, if we can go back 1 second. Again, we've got, you know, as your brain is working and you start digging in, you can very rapidly surface and understand these connections and who these other players are, right? So just by clicking in, we have this top area of raw data, but data, as we all know, is why we're here, and our mission is to provide clarity into that data by context. And what does that mean? In this case, benchmarking, right? So who is this guy and how does he compare to other guys like him? It's an apples to apples exercise that we feel up to this point has been extremely difficult to conduct, right? So Mr. Flores is in the 99th percentile of productivity, you know, for his type of specialty, basically all the way across, okay? So additionally, as we start working through, we can see where a physician is affiliated, right? With some of the proprietary technology that we created, who they are, who else they work with, right? And prescriptions that they prescribe, right? And the gross cost of that. So we're getting all of this data from, you know, sorry, 4 minutes, okay. So why don't we take a look at a hospital exactly? And we can look from a entity perspective, what does that look like? So this is a specialty hospital in Texas. We can understand, you know, what that revenue, what the referrals are, and as we start to look at the affiliated providers or who's working at that facility, we get our breakdown. And then in the list view, this is one of our new features where we're basically ranking all of the people who work at that or do procedures at that facility. And again, you can rapidly surface what the revenues are, what the referrals are, right? What the procedures are. And this button here, See More Like This Provider, allows you to rapidly then filter that list and go one step further. So, okay, I'm interested in the internal medicine physicians who are working here. I'm interested in the orthopedic surgeons, right? Because I want to understand what the market share or what the productivity share of for that particular facility is, right? And you can see that not only just for fraud, but anyone who is actively selling or trying to engage providers, if it's a medical device company, et cetera, this is facilitating the efficient allocation of human capital, right? Because you're no longer wasting your time with a shotgun approach. This is a logical, high yield way of getting to the people that matter. Additionally, you know, we're compiling things like HCAP scores, right, which aren't really fraud related. But you can also look from a facility perspective, both charges inpatient and outpatient.